and good morning, good afternoon, good evening to anyone there in the world watching this. I am honored to be here with the wonderful Marcos Patchett, who's a renowned herbalist and medical astrologer. And he's going to be speaking for our Herbalism Medical Astrology Summit coming up on November 9th and 10th. And I'm so excited to talk to him about his background and also about the lecture that he's going to be giving for us called Practical Remediation. So I had a chance to look up Marcos prior to this, and I was actually quite impressed. There's a lot of lectures of you online, not just podcasts, but actual lectures, speaking at symposiums, speaking at conferences. You're a guest lecturer at Kepler. You run your own school. So I just want to say thank you for joining, and thank you for teaching for us. And I haven't even given you a chance to say hello. So
no, thank you, Mel. Thank you. That's so kind. That's a very, very kind things. And I'm very excited because, as you know, I've worked with Judith before at Kepler and we work quite well together. I really enjoyed working with her. And obviously, Judith's been an idol or mentor from afar of mine for a number of years because, you know, her books on medical astrology were one of the first books I've got. And even when I sort of segued more into the traditional side of things, her books I still kept, which a bunch of other astrologers didn't make the cut, but hers did because they're so good. You know, I just like the quality of her thinking. So it's a great honor also for me to be speaking at this summit. So great.
Wonderful. So as I did research on you, I realized that the bio that you gave us for the summit, just to give information on you, is actually quite modest compared to what you've actually done through your career. Now, is that a British thing or is that just your
I don't know. Is it? I don't know. I guess it's a Capricorn moon thing, Mel, probably, because that's what I've got. So I kind of Capricorn moon in the third. So I kind of like to keep things pithy, I suppose. So yeah, and also I do have a near angular Saturn, which may be something else, you know, partially explanatory as well. So
yeah,
thank you.
It's a big influence. So what I noticed about you that you didn't put in your bio is that you actually started off supporting HIV patients through herbalism. And you did that for a number of years. Can you share with us a little bit more about that work and how that helped shaped your influence about how you want to serve?
Yeah, thank you. No, that was something that was really important to me because I mean, maybe TMI, but I'm a gay man. So for me, like growing up in the 80s, you know, the AIDS stuff was everywhere. And then, you know, so I kind of felt like I wanted to give back to quote unquote my community a little bit. So when I was studying herbal medicine in the sort of early 2000s, my degree course started in the year 2000. I graduated in 2005. And an opportunity came up after I completed the third year of my degree to work in a support clinic in King's Cross. And most of the patients there were HIV positive. They also saw some other patients like with MS and some with chronic pain and cancer, but it was mainly HIV positive patients. So I was like, brilliant. So I jumped to the chance and I really didn't regret it because I mean, the other thing, I like working with people living with HIV, not just from the personal angle, but because you see everything. You see everything when you're working with people living with HIV because it's an immune deficiency syndrome, basically. The medical things that can come up are just, you know, like everything under the sun, really. So there are certain things that come up more regularly. I mean, fortunately, things have moved on a lot since then. So 20 years ago, there are better, the medicines combinations are more effective now. Things are, but you know, so back then it was still, there was the combination therapy had just come in, but there were a lot of patients getting kind of side effects and a lot of survivors from the early days of the epidemic who were living with quite difficult conditions. So it was very interesting. So yeah, I did that for about 10 years.
Wow, that's a really specialized area, and people don't understand how complicated and nuanced it is. Like I myself, I have a pharmaceutical background. I'm not a pharmacist, but I worked for big pharma for most of my career, about 15 years. And so when we studied some of these diseases that have to do with the immune system, it's a very delicate balance.
It is. And you've got to be so careful if you're prescribing herbs and stuff to people in those situations, because you don't want to run the risk of neutralizing any of the drugs that they're taking. You know, it's so easy to give somebody a herbal comment. You think, oh, this herb will suit them perfectly. But if they're on medication that's keeping their viral load down, so it takes a little bit of a sort of careful oversight and monitoring a lot of the time. But in practice, it's like all of these things. You sort of, a lot of it was learning on the job in a sense. So you just start off being really, really cautious, and as you go along you sort of learn that, okay, these are situations where I can be a bit more adventurous, and this is when we have to hang back. But it was an amazing job, slightly terrifying, but amazing at the same time.
There's a lot there, because what people don't realize is that if you're an herbalist and you're working with anyone who has an immune disease or an autoimmune disease, there is a delicate balance between what you can prescribe to them that not only interacts with their medication, as you mentioned, but also something, if it makes their immune system too strong, it could attack itself. And
yes, well, potentially. I mean, with HIV, that's a whole interesting set of rabbit warrens going off from that one, because I read some articles, theoretical mainly, about how echinacea should never be given to HIV positive patients because it stimulates the immune system, and because HIV infects CD4 cells, which are the main cells that orchestrate the immune response. If you give echinacea, which could increase the turnover or replication of CD4 cells, you could potentially increase the reservoir of cells that HIV infects, and yada, yada. I read a few articles to that effect, but in practice, what's interesting about the pharmacology of echinacea, it contains a bunch of compounds like citric acid and a bunch of other ones, which actually are antiretroviral. So in practice, I never saw it do that. It seemed to be universally helpful, and other herbalists who work a little bit more with Chinese herbs have noticed similar things of astragalus, which the herbalist who's passed away now, Stephen Booner, wrote about in his book on antiviral herbs, and he said that astragalus also contains a bunch of antiviral compounds. So the thing is with plants, as you know, it's like you're working with a soup of chemicals, basically. So it's while taking a reductionist approach and filleting the plants for what they contain and what each of those compounds do is very useful on a mechanistic level to explain how they work. It's also incomplete because you're looking at how the plant works in practice as a complete soup, so which can be very different from how any of its individual components. Well, I know I'm preaching to the choir here, but this is what makes it sort of both complicated and fascinating and really exciting, because you kind of like, as you're going along, you have your sort of first principles and you have certain things which to be careful of. So there were times when, I would be a little cautious in giving immune stimulating herbs, but I came to a sort of hypothesis. I came to a sort of practice that seemed to work well, which was if I was giving immune stimulating plants like echinacea, I'd to a client or patient who wasn't taking antiretroviral therapies, I would combine them with other plants which would deal with their issue symptomatically, which just happened to contain a buttload of antiviral compounds. Because obviously, as a herbalist, I can't legally claim to treat HIV because that would put me outside law, but I can support people living with HIV. So it's kind of a bit like when you're working with people with cancers. I can't claim to treat their cancer, but what I can do is I can give the client herbs or plants that are suitable for their symptoms, which just so happen to have some nice anti-cancer or compounds in them. Similarly with HIV, if somebody's not on antiretrovirals, I would give them a bunch of plants which contained antiretroviral compounds, and that seemed to work quite well. And I never saw anybody have any problems with like their CD4 climbing and then the viral load going through the roof or anything like that. So it worked quite well in practice. Yeah.
Wow. So knowing what you know as an herbalist and then knowing what you know as a medical astrologer, how do you layer those? How do you see some of these diseases showing up in the chart?
Aha, that's kind of interesting. Okay, so there are so many directions I could go with that one. So, but it's great. So the first thing I would say is that slightly tongue-in-cheek, is with difficulty, because like anything, when you're learning a new technique, you find that the new technique slightly displaces the old one. So it took me about 10 years to kind of like work out how to mesh them fully, because as you know, when you're learning a new thing, you kind of get caught up in the new system. And then so there was a while where I was either leaning too much on the astrology or kind of going, oh, forget the astrology and going back to pharmacology. The practicum is that I mainly use consultation charts in practice, not so much birth charts. I use birth charts for clients who are coming to me privately and want me to do astrology explicitly. And that's mainly a practical thing, because doing birth charts and going into that level of detail takes time. And I kind of need to be paid for my time, because, you know, earning a living and paying bills and stuff. But with clients who are coming to me who know that I'm an astrologer and who are coming to me for herbal medicine, I can always just look at the consultation chart, and that will give a little bit of helpful info around what herbs to prescribe and that sort of thing. I can't say that I found any specific HIV signatures in a chart. You know, in birth charts, that there's sometimes, but not always, sometimes a Venus 6th house signature, because it is often, but not always, a venereal disease. But I mean, as you know, with astrology, things can show up in about 10 billion different ways. So, you know, but there is sometimes a venereal. So maybe the ruler of the 5th in the 6th, or Venus in the 6th, or that kind of thing. But by no means in every case.
Well, I guess the question was more around like the onset of symptoms. You know, like and not just HIV. I'm talking about disease in general, and people come to you. And they
so you're asking a question about decumbiture charts in a way there, I guess.
Like how, because that's really one of your specialties is decumbiture chart. And are you going to be referencing decumbiture charts in your lecture with us?
Yes, absolutely. In the talk, I'm going to be using, ironically, given what I've just said, mainly the birth chart, but I will talk about the difference and when you'll use one rather than the other: decumbitures, consultation charts, or houris versus birth charts. Yes. But I'll be focusing mainly on getting some remedies from the birth chart, because that is universally useful to anyone in this field, because like everyone's always interested in finding like constitutional remedies for themselves from the birth chart, and you can do that for astrological clients as well. To answer your question about decumbiture or consultation chart, decumbitures, a decumbiture, for anyone who doesn't know, is the chart cast for the time when the person first gets ill. And the word decumbiture comes from the same Latin root, I think, as the word recumbent, meaning lying down. So it's when the person gets so ill they, you know, lie down or collapse or whatever. So because you know, Culpeper even talks about this in his book on decumbiture. He says it's not when the patient has their very first little bit of a headache, or, you know, just it's when they're definitely ill, you know, so they go to bed. So a modern equivalent, I often say, would be a hospital admission time is a perfectly good sub for a decumbiture. All you want is a solid threshold time where the person is crossing from this period of wellness to illness. So admission time to a hospital is a good one. Getting a significant test result even. So the person might have been feeling okay. They've gone for a medical test. So you could take the time of the test or the time of the result. If the result is positive for some illness, then, you know, they could take that time definitively. But in practice, a lot of times patients don't have a decumbiture time, because I say this slightly sarcastically, people often don't happen to look at the clock just as they're collapsing. Do you know what I mean? And often people don't just collapse.
Astrologer,
you know I mean? It feels things like the gradual onset, or like, I don't know when I first got ill. This has been going on for years. So what I'll often use as the substitute in those cases is the consultation chart, because you've always got the consultation chart. And in fact, you know, consultation charts were, I think, probably the most used in practice. And Lilly talks about this. He talks about the hierarchy of charts. And it's always useful if you've got the birth chart, because from the birth chart, you can get somebody's baseline temperament and somebody's tendencies, like where their Achilles heel is, what illnesses they may be prone to. But not every illness, unless it's a major lifelong illness or a life-changing illness, not every illness is going to show in the birth chart. It might show with transits too, but it's not going to be necessarily described in the natal pattern if it's just a flu or even quite a serious flu. Maybe there's some dodgy transits going on at the time for sure. But
the transits may show it, but not necessarily like in the natal chart.
Absolutely. So, they might have Saturn going over the sun in the 6th house or something, and sure, but it's not. So for those, I would prefer, so the thing is a decumbiture, if you can get it in those circumstances, is great, because that will give you the specifics of the interaction of the patient with that disease. And then as a second best, you will get the consultation chart. And I think traditionally Lily recommend the time of the patient's urine being brought to the physician, which is what they used to do in the old days. They used to pee and then bring the urine to the physician. And so that's the equivalent of getting a medical test, isn't it? Do you know what I mean? Nowadays. So
yes.
So these days I mainly use consultation charts, for the practical reason that you always have that time, and that chart will always show you something about the interaction between you and that client and the circumstances going on around it. And obviously 95% of my consultations are about illnesses, so that's what the chart's going to be describing.
Yeah. So we could probably fill that book chart and more, the bookshelf and more with everything about plant medicines and diseases. But what are people going to be able to take away from you from your lecture, which is called Practical Remediation, Astrological Finding and Fixing?
Good. All right. Thank you, Mel. Yes, hopefully, I am hopeful that they will take away some very practical tools for using in birth charts. And we're going to be looking a little bit at a quick drive-by method of assessing temperament based on Dorian Greenbaum's method in her book on temperament. I've slightly added one little tweak to it, but it's basically Dorian's method, which we'll be looking at, and then how you use that practically. So, okay, if you can see somebody's temperament in the natal chart, how do you use that? What practical suggestions could you make to a client, or could you implement for yourself? And then we'll be looking at a consultation chart or decumbiture. No, I tell a lie. We won't be. We'll be looking wholly at the birth chart, but I'll be using the techniques that I'll be teaching are transferable. So you can use the temperament isn't transferable. That's always for birth charts. So somebody's baseline temperament, if somebody's baseline melancholic or phlegmatic or whatever. But the second bit of it, I'm going to be talking about what practical directions can you give to a client. And this, it doesn't matter if you're a qualified therapist or not. We'll be looking at what practical takeaways can you give. So if you're not a herbalist or a therapist of any sort, we'll be looking at what practical advice could you give somebody, a sick client who came to see you. And obviously, if you are qualified, if you do have a therapeutic qualification, you can sort of utilize that alongside that. So to give you a quick example, so that it's not quite so abstract, we could look in a birth chart, and we'll be talking about this in some detail, at where the ascendant ruler and the moon are placed and how they are supported in the chart, what other planets are supporting them, because the ascendant ruler and the ascendant ruler is the avatar of the patient and their body, and the moon is the avatar of the person's general health. So anything that is supporting them in the chart can be leveraged in a practical sense to fortify that person's health. So be looking at what interpretive principles do we use there. And a practical example, I finish it off with a case study of a live actual human from my clinic at the moment, who's consented to allowing us to talk about her stuff, which will sort of give a practical example of how that is actually done.
I'm so excited for that lecture. And even just talking about you, like you got some comments on our social media, like, yes, Marcos is the best. Everyone really loves your teaching style. So I'm so honored that you're going to be teaching for us. Thank you for joining us from the UK. It'll be really wonderful to have your perspective there. And just thank you so much for being here with us. Is there one last message that you want to leave folks with, or one thing that you're thinking is really your ultimate mission in your work?
Oof, ultimate mission. Gosh, I don't know. I mean, I guess I have several ultimate missions.
I'm sorry, I have a Scorpio moon. I'm like, what's your deepest, darkest?
No, great. I love it. I love it. I'm all in with the Scorpio moon. I'm Scorpio rising, so good. I guess ultimate mission. I would like my ultimate mission that I think is to, and it sounds cheesy, but I want to empower people to be able to improve their own health and give people the tools to help them know where to look to find their own answers. Yeah.
I love that. I love that. Thank you so much, Marcos. It's been a pleasure to host you, and I can't wait to watch your lecture for the summit.
Well, thank you so much, Mel. It's been an absolute pleasure. Thank you.